I think it looks like many other implementation projects if you look into different phases, but I would say that the planning part of implementing a platform like ours takes quite a lot of time and effort, because it's not only planning from a technical perspective, you also need an organization that understands the benefit and values of this, and you need to dedicate an organization around this. It's easy to get stuck in existing way of working. So when you want to implement a new way of working, it tends to kind of merge. It's a resistance there that, okay, this is the way we are structured today. These are the ways of working, and then you have a new way of working and a new system. That's where it becomes complicated when implementing this. So. And even though you understand the values that this potentially could do it, you need to invest. So that's the challenge. You need to invest time and money and resources into this before you get to that point where you see the impacts of working differently. Silo organizations, I mean, who is responsible for preventive care? It's not really clear. We know that healthcare should offer preventive initiatives, but when it comes into kind of execution, why should primary care invest time and money into something where you gain the benefits somewhere else, in society or in specialty care, etc.? So we realize that there is a challenge in the silo thinking with silo budgets, etc. Because this, as I said, from a broader perspective, working with prevention, you have a lot of beneficiaries. We have been talking a bit about the collaboration between us as a service provider or company and you as a region, the open and collaborative atmosphere. I mean, you need to have that mindset.
Of course.
Not that you are buying a service period and then you start using the service. That is really key, that the whole kind of project plan and implementation and maintenance of this, that it is built on collaboration. Yeah. As I said, continuous learning and improvement, courage mindset and bold decisions is needed when implementing systems like this. So you need management that can make sometimes bold decisions. The platform that we're talking about is based on a patient app that the patient uses at home, and we have the clinical web application that the healthcare professionals are using. So in the platform we today have different care pathways. So we have heart failure, we have hypertension, COPD, diabetes, mental health, and also we have developed also support for respiratory infections or COVID-19 now, when we saw that evolve. And based on what care pathway you are added to, you get specific setup of devices. So for example, a heart failure patient, it's really important to follow up on the weight. So they will get a Bluetooth connected weight scale at home. So, and basically the system and nurses will guide you in the right direction, how you should work with your challenges. So based on, as I said, deviations, the system will tell healthcare when and where to take action. And in some points, it's more about coaching the patient to be more healthier or do something in particular. And to some extent, we can let the system do that coaching. The big challenge is not to implement a new digital platform, it's more that you are able to clarify the purpose, the values, and how to organize around this to make it work. So Yeah, there is a long list actually with the lessons learned, but I think that I've covered some of them in previous questions as well. The trial and error, that you need the courage to test, evaluate and learn. I mean, dedicated resources, clear mandates we talked about as well. First of all, we have really good clinical outcomes, which is really important here when we look at these patient groups. So within heart failure, we still have no heart failure patient that has ended up in the hospital.
Okay.
And it's really good figure so far. So what we want to evaluate now is to see when we scale this up to even more heart failure patients in rural areas, can we keep them away from these acute events?
Okay.
And by that preventing ambulance transports and unnecessary acute care, etc. So that's really, it's a good trend. Also on hypertension, we see that the blood pressures lowers over time, and that I think is a combination of having healthcare working in a different way with hypertension patients, but also that patient feels secure in a way, just by the fact that you know that if something deviates, someone will get the notice of this. The patient experience that you feel that you have better access to healthcare. The healthcare professional experience from the project has been well as well. That it is a more kind of patient-centric way of working, that you as a nurse can focus on patients in most need, so to say. Because if you can, to some extent, remove or move the responsibility of what patient actually can manage themselves in the home, you get more time to spend at the healthcare center with patients that is really in need. We also get feedback that you can handle so many more patients in this way. That on a regular day you might see, I don't know, 5-10 hypertension patients, but you can actually track 50 patients.